I'm Dr. Karl Kabasele, public health physician. Parkinson's disease is a neurodegenerative disease, which means that it's caused by a breakdown of nerve cells. Your nerves control your movements by stimulating your muscles. But when those nerves that govern movement begin to die off, you can start to see the symptoms of Parkinson's disease. Most commonly, those symptoms include tremor or shakiness, slowing of your movements or stiffening of your body, problems with balance, and rigidity of the muscles. Joining me to discuss the latest advancements in the treatment and management of Parkinson's disease is Dr. Galit Kleiner-Fisman, who is a neurologist who specializes in movement disorders. Dr. Kleiner-Fisman is on the phone from her Toronto office. Dr. Kleiner-Fisman, I've listed some of the symptoms of Parkinson's disease, but in your experience working with patients, what is the impact or the human cost of the disease?
Thanks, Karl. That's actually an excellent question because really the human cost is what this is all about. Parkinson's affects every aspect of a person's life, including what we can see, like tremors, slow movements, and difficulty walking, as well as what we can't see, like changes in ability to think clearly, impact on mood, and control of bodily functions like bladder and bowel, amongst others. Of course, such changes impact the whole family in addition to the individual living with these symptoms. There may be difficulty in working or enjoying leisure activities, as well as changing roles in a relationship. For example, a couple may go from being in equal partners to one person is dependent on the other for provision of care and facilitation of activities of daily living.
Okay, so we know that there's a really good medication called levodopa, and that's used to treat Parkinson's disease, but this is more than about just medications. Your work sort of integrates the medical side, but also kind of looks holistically at the patient, and you work with a lot of other professionals as you're dealing with patients with Parkinson's.
Yeah, in fact, that's exactly right. Parkinson's isn't just about taking a pill. It's about looking at the entire person and all their needs. So it's not enough to just have a doctor on board, because my role as the doctor indeed is to look at the overall big picture and provide a specialized and tailored medication regimen, but it's also to identify all the other things that are affecting a person's life and use my allied team. I'm very lucky to work with numerous experts in terms of occupational therapists, physical therapists, speech therapists, a dietitian, a pharmacist, a health psychologist, a social services worker. We have a lot of people to support people with Parkinson's.
That's quite a team you got there.
Yeah, it's really unique and maybe the only one in Canada. And the whole goal is to basically meet all the needs of people as well as their families that may be both medical as well as social. And these are all factors that contribute to a person's life and how they perceive their life. And what we want is people to leave the clinic feeling supported and that they have partners to help them meet their goals in their life.
Right, and it sounds like with all of those allied professionals sort of on board, it's a great opportunity to prevent crises from happening and to kind of maximize people's functionality.
That's exactly right, because once a crisis has happened, it becomes much more difficult. For example, if somebody falls and breaks their hip, then down the road, what happens? Now they're in the hospital. Now they take all kinds of pain medications. Now they become delirious. It's just a terrible downward spiral. If you can anticipate somebody who is at risk for falling and then create, for example, an exercise program or send in a team to do a home safety evaluation, if we can recognize in advance the things that could become a problem, then we can prevent them. That obviously has an impact on the person themselves, their family, but if you look at it from a societal point of view, it also has an impact on healthcare resource utilization, which is extremely important.
Okay, it's interesting you bring up the idea, you gave the example of somebody falling. So you have that sort of rigidity and spasticity of the muscles and the tremor, which can lead to falls, which obviously can lead to very serious complications. But tell me a little bit about some of those problems associated with Parkinson's that maybe people don't think about, but simple things that can be done to prevent major catastrophes down the road.
There are numerous different, there are so many little things that if you attend to them can make up an entire big thing. So we try, as I said, to look at every single factor that may be contributing to a person's ability or disability. For example, little things that people can know that can improve how their medication works for them, and therefore perhaps if their medication is working better, they're less likely to have problems walking and therefore at risk for falling are things like managing constipation. People with Parkinson's often have constipation. It's a very, very common symptom, and they disregard it even though it may have a big impact in their life. So it's extremely uncomfortable to start with. Mm-hmm. But then also in terms of how medication is absorbed, if somebody is constipated, then things aren't moving forward in their gastrointestinal tract. When they take their pills aren't being properly absorbed, and therefore they're not working the best that they possibly could be working for them. So just management of constipation in and of itself can have an impact on how medications work. Another related issue and topic that people don't really know about, although it's so simple to change, is that taking protein and levodopa at the same time may also result in decreased ability of the levodopa, which is that main medication that people with Parkinson's use, to work effectively. So there's a competition between protein and levodopa to get into the bloodstream, and if they're both there at the same time, then the protein always wins that competition. So a simple thing such as taking pills half an hour before eating protein is enough to make the medications work better for them and, again, potentially prevent a fall.
Galit, thank you very much for your time and your insights into the world of Parkinson's disease. And certainly it's, as you have said, it's complex, but armed with the right information, I think people can do quite well.
Absolutely, Karl. Thank you very much for this opportunity. And indeed, my parting message is that people need to have hope and that there is a way to live well with Parkinson's.
I've been speaking with Dr. Galit Kleiner-Fisman, who is a neurologist in Toronto and an expert in Parkinson's disease and other movement disorders. For more information on the project that she discussed today, go to www.livewellwithparkinsons.com. I'm Dr. Karl Kabasele.